In this video, we hope to demonstrate one example of how to do a complete oral cancer examination, including asking important key questions for oropharyngeal cancer detection. By performing the exam in real time, hopefully it'll show how easily OPC can be incorporated into any oral cancer examination. The goal is for dentists to do an oral cancer examination on all patients at all visits. When performing the exam, verbally educate all patients about the importance of oral cancer screenings, emphasizing how important early detection is. Discuss risk factors, tobacco, alcohol, e-cigarettes, hookahs, etc. Also, a discussion about the HPV vaccine, especially if they have children as a tool for cancer prevention. Finally, don't forget to ask the OPC 11 questions during your exam. Oral cancer screening. Performing a complete oral screening regularly during every exam can be the first step to early detection of oral cancers. Dentists can dedicate a few minutes thoroughly conducting an extraoral and intraoral exam and potentially save a patient's life. But how does one perform a comprehensive screening? This video will outline and illustrate each and every step. Step 1, the extraoral exam. We'll start off with an extraoral exam, focusing on the lymph nodes around the head and neck. Before any palpation, the dentist should thoroughly examine the head and neck for any asymmetries, as well as observe the vermilion border of the lip, the hairline, and scalp for lumps, abnormalities, or ulcerations. Many throat cancers demonstrate asymmetry around the cervical lymph nodes. Next, the dentist should palpate underneath the chin for submental and submandibular nodes, feeling for any lumps or irregularities. Here the dentist can also ask the patient to swallow while palpating the neck and thyroid to check for any irregularities. The dentist can ask the patient to turn their head to the left and to the right to check the lymph nodes in the anterior and posterior cervical triangles near the sternocleidomastoid muscle. The dentist should also palpate the occipital nodes at the base of the head and continue to the retro and preauricular nodes. As the dentist approaches the TMJ, they can ask the patient to open and close, noticing any irregularities with the joint. Lastly, dentists should also check the supraclavicular nodes. If all appears normal, the extraoral exam is complete. Step 2, intraoral exam. Donning fresh gloves, the dentist can now begin the intraoral exam. Here the dentist can begin by observing the gingiva for abnormalities in color, texture, or growths. Next, examine the labial and buccal mucosa for uniformity in color and texture, running a finger over the cheeks and depth of the vestibule. Once this is completed, the dentist can observe the hard and soft palates. The dentist should ask the patient to stick their tongue out, where a careful check of the lateral borders of the tongue can be done. Are there any visual abnormalities in color or texture? Are there any abnormalities to palpation, such as lumps or nodes? If so, are they over 2 weeks in duration? The dentist should also pay attention to the anterior and posterior pillars, the palatine tonsils, and the posterior pharyngeal wall. Next, the patient should put their tongue on the roof of the mouth so the dentist can observe the floor of the mouth. The dentist should palpate the sublingual glands, pushing down on the floor of the mouth while simultaneously palpating the area extraorally, two-hand palpation of the floor of the mouth. If all appears normal, the intraoral exam is now complete. Conclusion. It is important to be vigilant advocates for our patients' health. Though it may seem like a time-consuming process, a thorough oral cancer screening could potentially save a patient's life. Oftentimes, the detection of a positive node during an extraoral exam may be the only clinical sign of oral cancer.